Hello, everybody. This is Dr. Hassaballa, and this is the first episode of my new podcast, Healthcare Musings. Um, and this is going to be hopefully a regular series of article voiceovers and other voice notes. I hope you enjoy it and join me. Please uh, make sure you sign up for my newsletter. It's free on healthcaremusings.com to get all of the posts into your email. And in addition, it'll be available on Apple Podcasts shortly as well. And you can follow over there. So my first episode is about the unsustainable math of Medicare cuts to physician payments. Most recently, CMS, the Center for Medicare and Medicaid Services, announced another 3.34% pay cut to physician pay, and this is simply unsustainable. And I'm recording this on shift, so if the unit were to call me, uh, I apologize for the interruption. So let me get this out of the way. Yes, physicians earn a very good living. Many, if not most, physicians make way more money than the overwhelming majority of the population. I get that. In fact, I know many specialists make way more money than the President of the United States. You have to understand that in order to make that money, it takes literally decades of schooling and many years of training, all the while racking up hundreds of thousands of dollars in debt. In order to become a specialist, the path is even longer. It can take more than half a decade before you can begin earning money, all the while racking up debt. And it's also true that primary care physicians are among the least paid of our profession. And this is unfortunate because they are the bulwark of the healthcare system. I think they're the load-bearing walls of our field. And it really is unfortunate that they can make less than many other professionals in the healthcare field. Having said all of that, these latest rounds of physician pay cuts by CMS, the Centers for Medicare and Medicaid Services, are just unsustainable. And they state, and I'm quoting from their website, by factors specified in law, overall payment rates under the PFS, which is the proposed physician fee service, are proposed to be reduced by 1.25% in calendar year 2024 compared to calendar year 2023. CMS is also proposing significant increases in payment for primary care and other kinds of direct patient care. The proposed calendar year 2024 PFS conversion factor is $32.75, a decrease of $1.14 or 3.34% from the current calendar year 2023 conversion factor of $33.89. So what this conversion factor is, unquote, what this conversion factor is, it's a multiplier, and we multiply that number, that dollar amount, by the relative value units, which is a measure of how different procedures, how difficult or how much work a physician or clinician does doing a particular procedure or seeing a patient or a consultation. And that's what's paid by Medicare. And it's only 80%. The other 20% is paid by supplemental insurance if the patient has supplemental insurance. Naturally, physician groups immediately decried the cuts. So I'm quoting the president of the American College of Rheumatology. He says, while the ACR appreciates CMS's continued recognition of the value of complex care provided by rheumatologists and other cognitive care specialists, we are gravely concerned that the proposed rules physician payment cuts contained in CMS's conversion factor would add to physicians' uncertainty about their continued ability to provide the highest quality of care to Medicare patients. The president of the American Medical Association also weighed in a statement saying, quote, when adjusted for inflation, Medicare physician payment already has effectively declined 26% from 2001 to 2023 before additional inflation and these cuts are factored in. Physicians are one of the only providers without an automatic inflationary increase. Physicians need relief from this unsustainable journey, unquote. Anders Gilberg, the senior vice president for governmental affairs at the Medical Group Management Association, MGMA, also said in a statement, and I quote, the proposed 2024 Medicare physician fee schedule raises significant concerns for medical groups related to a 3.4% reduction to the conversion factor, which further increases the gap between physician practice expenses and Medicare reimbursement rates. Medicare already largely fails to cover the cost of furnishing care to beneficiaries, and the proposed cut to the 2024 conversion factor compounds the problem, unquote. And this is the key, is to understanding why we are upset about these cuts. It's not about being greedy. And I know people just quickly will go, oh, doctors are greedy. They make a lot of money and they're just greedy. It's not about a doctor who made $400,000 in 2023 is now going to make $388,000 in 2024. No, it's about the costs of running a practice. Again, as noted by the AMA, when adjusted for inflation, physician reimbursement has declined significantly by more than a quarter. But the costs of running a physician practice have not decreased by that amount. If anything, they have increased. There has been a 7% inflation in healthcare labor costs. And now CMS answers this increase in costs with another 3% pay cut. This math is simply not sustainable. I used to be a partner in a small private practice. Yeah, I made a good salary, but it costs a lot of money to keep the practice open. You got to pay the salary for the staff. You got to pay the rent for the office space, utilities, office supplies, toilet paper, telephone. If you have an electronic medical record, that costs money, and none of those costs ever go down, ever, right? But every year, every so often, reimbursement from CMS and other payers does decrease. And eventually, if the costs of running a practice exceed its income, the practice closes, or they stop taking Medicare patients because the reimbursement is not enough to cover costs. I mean, it's a simple math problem. In very large practices, there are other costs, such as the interest on the loans that they take out to cover payroll have increased dramatically because of the inflation and the Fed trying to reduce inflation. And so those costs have dramatically increased. And every time reimbursement gets cut, it just makes staying in business that much more difficult. So this is what physicians and their groups mean when they say that payment cuts by CMS threaten access to care for seniors. If practices close their doors because the math is simply not sustainable, less doctors are going to be available to care for our seniors. Those are my parents. Those are your parents. Those are your grandparents. Those are my grandparents, right? So, if they were still alive. There's already a shortage of physicians, especially in rural areas. And if these payment cuts make it worse, and if these payment cuts lead to more practices closing or stop taking Medicare patients, it's only going to make that shortage worse. Now, paying primary care physicians is great, right? It's about time that they get paid more. They are the load-bearing walls of our healthcare system. But what I don't understand is that the law forces CMS to take money from specialists and other clinicians and healthcare professionals to give it to the primary care physicians. Why? That makes absolutely no sense. Well, they say, specialists make too much money. That's a non-argument. The formula is flawed, the philosophy is flawed, and it has to be changed. It has to be something much more sustainable. We can't just keep working harder for less reimbursement. This is what leads to burnout. This is what's driving physicians out of the profession. Okay? And how does that help our patients? And furthermore, when a plumber comes to your home, fixes your leaky faucet or your shower, and gives you a bill for $200, no one says, well, I'm only going to pay you $120. But that's what they do to physicians all the time. And this math is not sustainable. Physician reimbursement, physician and clinical care is only $1 out of every $5 that CMS spends. Okay? It's not right that they keep cutting physician reimbursement to reduce healthcare spending. There has to be a better way. Thank you so much for listening, and I look forward to seeing you on the next episode of Healthcare Musings.